Hello, everyone, and welcome to another podcast, audio podcast in this fourth series around the LabZtorm impact, and this is going to be around healthcare science and science and research impact. This audio podcast is going to be kind of sectioned into three or four different focuses. There'll be an introduction, some aspects around health science and the diagnostics around sort of excuse me, laboratory practice will be highlighted, and then also information on context around on more specific investigations, and then there will be some focus on service provision from sort of a laboratory practice perspective, and then I'll close off with a sort of a summary, and I will highlight a few sources, resources for listeners to check out at their own time. This is the Shience, and it's another Storm Robotics production. So let's crack on. So to begin with, in this audio podcast, I'm going to highlight some context around sort of a basis of the laboratory the laboratory sort of scientists and what that's about. The core focus of such health professionals are the delivery of patient-centered care, and those going and providing and aspects of laboratory practice through supporting healthcare with those who have long-term conditions and are either sort of facing lots of different comorbidities, or have ailments that are continuously focused around, etc. Basically, access to reliable diagnostics and understanding of test investigations and results and so forth are basically in the realm in the remit of what laboratory practice is about, and being more pronounced in the delivery of integrative practice between laboratory test investigation analysis, tests and investigations, so that patients can receive utmost care and best practice, and alongside with that, what isn't really done but has been documented and has been referred to in some context in the previous some previous audios and podcasts in between series 1, 2 and 3, and in this series as well, is that there's an educational perspective that just has not been implemented by laboratory scientists, and there's obviously advantages and disadvantages to that, but that has not been done. So scientists could have more opportunity, or should have more opportunity to build on aspects of the continuous professional development and on existing trained skill sets, so that the understanding around the weaknesses around the incapacities of what happened in line with the general public, owing to either misinformation or overkill with regard to how information and context is interpreted through, for example, the media, whether that's social media or the mainstream media, for example. Just a side note on this point, it's not to be confused with conspiracy, etc., but actual balancing understanding between what is in the media versus how the perspective comes across for those who actually receive that understanding or are looking to get an understanding. For example, so healthcare scientists could have more or should have opportunity to build on their continuous professional development and their skill set, so that the context that they can bring out is in good keeping with those with the general population, and so that patients have so that patients and the general public are going through different sort of health crises or challenges, whatever the case might be, that they potentially have an approach such that understanding can be provided through, for example, allied health professional sort of led clinics, online sort of educational kind of clinics that can offer some sort of additional understanding, and especially if there are people out there that are actually either discriminative or ignorant generally, then basically if they don't interact with written language or understanding in that way, then perhaps being able to listen and take understanding in that context, so thus to decipher and kind of measure up between good and bad sort of understanding or context, so that's to make decisions around aspects of healthcare. That is something that still needs to be sort of or could be investigated, but it's down to the general public as to how they want to understand or get a perspective. People generally interact in different ways. That being said, untapped sort of knowledge or understanding could be used in the delivery of supplementary educational support for patients and the general public, and those with particular long-term conditions and multiple comorbidities, so that the interpretation of lab tests and investigations and the analyses around them according to different parameters and reference ranges can be understood that much better. And again, I made mention in previous audios and podcasts the examples of some works by those involved in the renal patient support group, or the RPSG, and they have something similar to AHP or allied health professional type led clinics, wherein between some of the social across the different social media that are attached to that sort of work around exploring areas and focuses of support around chronic kidney disease, for example, there is different ways that patients and the public, and even professionals can interact and sort of use the social media platforms to sort of gauge intrigue in one way or another. So works by Rainey and team in 2020, and Goldstein in 2000 and team in 2013, and Jenkins and team in 2007 retrospectively, and Donald and team in 2018 sort of highlight sort of the gaps where educational support need to be bridged, but also highlight where and which specific areas of educational support still need to be linked up, and therein actually and therein there is opportunity really for different kinds of professionals, health professionals, to get involved. And again, the Renal Patient Support Group, or the RPSG team, and what they've done have actually been able to bring in different cohorts of people to bring understanding around different topics, and that's so this forms part of the introduction of this audio podcast. Now, next, I'm going to talk about the sort of health science education and more around the diagnostics. So, and I'm gonna provide this perspective from a sort of a UK perspective. The National Health Services, unfortunately, for all its advances, has not been ready for development, so that patients and the general public can actually rely significantly on significantly in a way, so that that there is raises so that there is confidence in aspects of the care that they receive. And so therefore in that context, when it comes to funding of particular services and healthcare, and particularly in the UK being a smaller country than some of the others around the world, for example, when it comes to funding of specific areas and services, there is compromise, and then there is also a lack of resources, and also when it comes to service provision, then there is a problem with how patients and the general public interact with healthcare services more longitudinally. Thus, there is a problem with how generally patients and the link between patients and professionals also are sort of hindered or bordered. So there is some work around that by Smith and team in 2013. So this also means that focuses around sort of dare I say it, for example, technology-driven health, and those advances they are all also compromised and are not as joined up as they should be. And this is where basically, when it comes to aspects of laboratory practice, wherein generally in laboratory practices in different areas of pathology, for example, when looking at services in aspects of different areas of tests and investigations based on requests that are received. For example, there is integration in that regard, but then from the laboratory practice side to other areas of healthcare, that's where it's a problem, and also it's and this is nothing new, I don't think, listeners, but there is problems from areas of healthcare and in between health sectors. So that being said, though, sort of areas of laboratory practice can lead and have led to the transformation of sort of bespoke quality and sort of areas of sort of automation and calibration related areas of interpreting science tests and results that and ultimately how patients receive their test, their actual based on the requests that frontline healthcare professionals have. They receive the appropriate test parameters in keeping with that the results around that particular test and investigation. So that being said, but also in keeping with this context, is that healthcare scientists could potentially have more patient-centered care, implementing again focuses around point-of-care testing activities. Retrospectively, that has been done in areas of, for example, hematology and in biochemistry. However, at present, point-of-care testing initiatives are restricted to in secondary care, in specific areas of secondary care. There are point-of-care testing focuses in primary care, but again, that's there's misalignment in that context as well, because for example, not everyone is able to kind of interact with point-of-care testing, and then at least where there is sort of involvement, if there is involvement, then at least in secondary care, where there is involvement, point-of-care testing can actually have healthcare scientists involved to be part of to be a link really between the laboratory services and practices and actually in wards or on the front line, with regard to quality assurance around tests and kits that might be at patients, for example, bedside. Now, point of care testing services in the NHS prompts quality assurance of kits, as mentioned, and screening, so that patients in hospital settings are provided best practice. At present, however, such professionals, whilst there might be some examples of that in different areas around the UK, they're not unified, and are not, and obviously healthcare scientists in part their training are not clinically trained, and this prevents such professionals actually implementing certain aspects of educational support, or even guidance to support care on the front line. Diagnostics and focuses between point of care testing and laboratory practices can encourage broader integration, and so that would prompt service user empowerment in a different and perhaps in a more dynamic manner, and education can be part of that. Educational support can be part of that, to bring back a more rounded or robust service to those patients and the general public who use services between healthcare sectors. There is a paper by Bath in 2012, and a paper by Donaghy and team in 2019, and a really good retrospective paper is by Beestall in 2008, who provides an overview of links between laboratory practices as well as different areas of healthcare services and between healthcare sectors. That all being said, there is opportunity where websites and desktops, websites or websites and sort of online spaces could be adapted or used to communicate between healthcare services and health education, healthcare services and health educational support, so that patients become not just more empowered, but actually are able to interact and also become more informed with aspects along their healthcare journey, and relating to aspects around health and disease. So now I just want to highlight a little bit about a focus on the laboratory, more specific focus around the laboratory perspective on this, and that is to say, at least that many there are patients out there and the general public who request, who want further understanding around medical terminology or clinical terminologies in one way or another, albeit not in mass or in mass numbers, for example, but However, the study, there are studies highlighting that there are general disparities between focuses around technology and systems and apps, which can actually make it a challenge for patients and the general public again to interact with our sort of information that would stand to benefit them, because again, when in previous audios and podcasts, what happens is that, or can happen with systems, technology, and apps, for example, is that it can stop, or they can stop, or prevent at least individuals and obviously those in the general public, etc., to actually question aspects of their healthcare, because everything becomes more or less quite trend-like, and so. And there's actually quite a nice paper by Mold and team in 2018 that look at that, and it is quite a good read. Patients are especially concerned, or the general public can be concerned, if information contained in as part of their electronic patient record, or their EPR, or the context that they that is sort of surrounds aspects of their healthcare, may look or appear constrained, and also highlight, for example, abnormal versus abnormal results versus normal results, etc. So what this also, the work by Mold and team and others have highlight that the work also highlights there are gaps in allied health professional contribution to patient education, and this again is consistent with the work by Rainey and team in 2020. This is again where works by the renal patient support group have also highlighted that there is where there is more research around that focus is required, owing to an increase in advances in areas around technology, and those advances in technology are also hindering and causing more barriers, and actually numbing mindsets, and also prompting ill health through either misinformation that comes part of those technologies and apps, etc., but also how health literacy becomes absolutely confined. And in this context, owing to with that, there can be a use across ill use, across different areas of health and practice, relating to especially around a certain and specific or even particular long-term health conditions. And more work around that has been highlighted by Diamantidis and Becker in 2014, and Goldstein again and team in 2013. So I'm now going to highlight just a little bit about sort of extended sort of services or in this context. There is now an increasing sort of body of research focusing on linking educational educational support, literacy, literacy across healthcare generally, and Nutbeam has highlighted this in 2000, and he has highlighted it in 2018 in two of his at least two of his papers. And there's work by Hardiker and Grant in 2011, and again Diamond, Titus and Becker in 2014 and in 2012 have also highlighted this. Therefore, it seems somewhat transparent that communication and integration is becoming more important to patients with certain long-term conditions where there is less face-to-face contact with health professionals. This, however, also presents an opportunity again for health professionals. For example, again, for example, those who patients and professionals alike, for example, know that exist, but are not part of not part of frontline practice. And so in that context, to be for those particular health professionals to be involved in driving in supporting aspects of healthcare guidance and educational support relating tests and investigations through sort of online space, there is a requirement to that, especially at least in some context, and because there is still a lot of misinformation that borders around, for example, COVID-19 and the dilemmas that come with that. And it's also where patients, for example, and patients from one perspective, and then versus professionals from another perspective, where either way, both seek to establish answers to important diagnostic questions. There's work around that by Beestall again in 2008, and Mould more recently in 2000, Mould and team in 2019. There's also research by Mohammed and team in 2020 that highlight focus around the educational support and as well. However, this sort of novel way of working, whether face-to-face or remotely, would help extend a certain service provision in a more dynamic way, and thus link areas of service where there are health professionals within the sciences who are, for example, have sort of that knowledge or sort of understanding where where context can be shared with those in the general public, etc. Thus, outside the traditional laboratory practice setting, that is where sort of those who are in the sciences should want to have kind of a mixed effort to ensure there is a bridging between sciences and frontline practice. And then in this context, it would be important to bear in mind, though, that professionals in areas of healthcare between healthcare sectors as well may have an impression of the reliability, may have a different impression and understanding of the reliability and the helpfulness of pathology services or pathology departments through interactions with scientists as well. Most communication at present or retrospectively has been through where professionals between the two, between areas and the sectors, have been through electronically and through other medium, and also how scientists themselves reflect areas of practice into standard, what are referred to as standard operating procedures. And there is again some work around that, understanding around that by Bath in 2012. This is that would be where there is a form of professional to professional support, and also actual understanding of practices in a better sort of way, or more proactive way. However, also owing to the developing of different initiatives, and again I'll highlight the work around, for example, the renal patient support group. Initiatives can help and can take shape in and can be involved in several ways, included whereby patients and professionals educate can become more empowered and take ownership, so that thus to not just prompt more interconnectivity, but also help inform areas of healthcare, and that understanding from frontline practice, for example, do not always know, for example, what happens in laboratory practices, but are pertinent to patient care, and that is vice versa as well. So there needs to be that, or should be that encouragement, so that there is understanding around that. And there's work on this in a paper publication by McCarthy in 2017. Generally, the context by McCarthy in 2017 looked to inform or highlight the importance around informed healthcare decision making. And so this also generally or potentially has where there is that sort of a link between the sciences and clinical medicine, for example, that can also encourage more robust focuses around research as well, and this also generally initiatives. Everyone has the ability to take initiative. It's whether individuals actually are sort of want to sort of take the time to, like, for example, take a step back and actually look at things with a view to sort of prompt sort of interconnectivity by it sort of in a bird's eye view, so thus to gain change really how patients should be providing healthcare to patients between healthcare sectors as well, and that initiative, those kinds of initiative, should also involve or could involve a capacity where both patients and professionals take initiative to learn and become more involved, so thus to intact their skill set, and allow a more command over their sort of the fundamentals around what they started around, for example, looking at why they went into, for example, medicine or clinical medicine or medical practices or the sciences, etc., etc. So that is so this understanding, listeners, is basically what healthcare and healthcare practices and healthcare sciences should be understood in line with educational interconnectivity. I'm now going to just provide an overview or a summary in this around this, and this is what I'll say here. What should be appreciated is the same professional attitude between healthcare sectors when patients are speaking to professionals, or professionals are speaking to patients, and that includes the terminology and the language, so that that context can be relatable to between each other, and actually sciences and laboratory practices are very much sort of about that, when ensuring there's the correct interpreted results when patients receive aspects of healthcare to aspects of healthcare in their electronic patient records. For example, opportunities for those who are very used to laboratory practice to work outside the confines of pathology have been highlighted, but not completely implemented. There are scientists who are, for example, in laboratory practices that are, whilst they could be overqualified, even whilst they can be overqualified, they cannot adapt or implement their skill sets to other areas, and that includes actually the educational perspective, which is a bit of a dilemma, and it is problematic in one way, because as more scientists, for example, become qualified, trainees, for example, as people become more qualified, the skill sets that scientists have in laboratory practice become, whilst they have, what I'm getting at, listeners, is that there is a skill set that they have, like any other health professionals in any other health professional groups, but being in laboratory practice, whilst it's a kind of a link between healthcare sectors, the practice that the laboratory scientists have are not they're not adaptable, at least in the view of most healthcare scientists, from which should allow them to use and implement their educational efforts in outside laboratory practices, but that's not happening, and because of the issues around finances, etc. Pathology, however, generally has been actively prompting updates to sort of areas of service provision and integration for some time, but there is a requirement for general development, where scientists in laboratory practice do not or cannot see scope outside of their practice, and in all fairness, listeners, there are very well trained scientists in these vicinities that without those health professionals in their own entity, that they cannot the lab practices generally that surround disciplines in areas of pathology would perhaps be either compromised or incapacitated, thus overall affecting quality of patient care on the front line. And there is documentation around this, actually. There's a paper by Lippi and Plebani in 2015 and 16, and this Lippi and Plebani are a Italian team, and they basically highlight where there is different some aspects around the importance of ensuring parameters and reference ranges are correct, pathology. There's a sort of a guideline paper by Pathology Networking in England in 2019 that was published, and which has been quite an intriguing read. And then NHS England in 2014 also highlight some information there about that as well. And then overall, I'm going to say there's a further element that also perhaps requires understanding, is the willingness to bring stability and smarter access to services to those patients who sort of battle and have crises around areas of medical or clinical terminology. There is a nice paper actually by Thompson and Taylor, which was published in 2015, that talk about areas of literacy and generally allied health professionals could be more involved through patient sort of patient activation, participation and mentoring initiatives, and this could also help sort of those funding bodies or commissioning bodies and health professional organizations understand really how the scientific and pathology community could potentially be sort of more patient facing in one way or another, in perhaps prospectively. Certainly sort of where there is evidence of more remote working and different initiatives happening in that regard, allow opportunities for all kinds of professionals to practice aspects of what they do. Where there are those sort of advances, more discussion around that, focusing on integrating aspects of sort of healthcare practices in different ways are still to be sort of understood and published, and ultimately sort of there is a requirement really to join up services to better the care of patient lives, and there is work around understanding around that by Petsulas and team in 2015, and Shaw also highlight that in 2013, and Mohammed highlights a little bit around that in works in 2000, Mohammed and team in 2020, and Mohammed and team in more recently in 2000, Mohammed and team in 2021, and so there is with previous audios of podcast listeners would know that I've read out a few references for resources that they can check out in their own time. Those that I've mentioned in throughout here, through this audio podcast, feel free to check those out. I won't read out the sort of a reference list, but do feel free to check those out, those resources in your own time. So that's what I'm going to end on, and this has been the Scientist, highlighting context around healthcare science and research impact. This is the series on the LabZtorm impact, and it's been another Storm Robotics production. Thanks for listening, and I hope you have a good one.